taking charge of every facet of our lives, and this is Take Charge with Sophie. My name is Sophia Kakwite. We've been doing a lot of series on infertility, the causes, the misconceptions, and all that. But in this episode, we'll be talking about the investigations that can be done on couples that are having issues with infertility, and then the treatment options that are available. So enjoy this episode, make some notes, share your thoughts in our comment sections as you watch, and share your experiences as well with us. It will be very valuable to someone who is also watching to pick a thing or two to help them overcome their situation. So we'll start with investigations for childless couple. So the treatment of every medical problem begins with knowing the causes of the problem. The same principle applies in the treatment of childlessness or infertility. Once the causes are known, it becomes much easier to treat them effectively. So here are some investigations that are done on couples. For a woman, infertility tests for women. So as mentioned earlier, the female causes of infertility may be the uterus or womb, the tubes, the ovaries where the eggs are, and then the structures. So these structures need to actually be checked whether or not they are normal. So one of the first investigations you should do is to check if the womb, the tubes, the ovaries and the eggs are normal, if everything is okay with them, because anything that affects them will affect the chances of conception. And then the testing of the uterus. So the womb is where the pregnancy will develop for 9 months before a woman delivers. It is therefore important that the womb is normal to perform this function. The woman is examined to see if the uterus is normal or not. So the ultrasound, we call it scan here in Africa. So an ultrasound is supposed to be done. Once they do an ultrasound scan showing the uterus, they'll be able to identify if there's an issue, and then that can also be tackled. Then the testing of the tubes. So they'll do a laparoscopy with a dye test to know what the issues are with the tubes. Once they are able to identify what the issues are, then they will be able to find a source. They will also do an ovulation, testing for ovulation, the release of the eggs. So once that is done and they are able to know whether the eggs are actually being released, then a solution can be found to it. And then for the male investigations, the man must release a healthy sperm. We have mentioned that earlier. The count, the movement, the shape is very, very important. So attention, men. Many men are still very reluctant to do a simple test when it is required. So it's very important. The fact that you release sperm does not mean that everything is all right. So they need to do a semen analysis. Once they do a semen analysis, they'll be able to know where the issues are, and then they'll be able to find solutions to them. So it's very, very important that this be done. Now let's move to the treatment options. Treatment of infertility and childlessness. So the treatment of infertility begins with counseling of the couples on how pregnancy comes about, and then they should understand that pregnancy is a chance of occurrence, and it's not something that they can get on demand. So they will counsel you, and you know that it's not something that you can just say, I want, and you get. So many factors come to play. So sometimes the woman is giving general measures. Will give you some vitamins, maybe vitamins E, vitamins D, and all that. And then if they will counsel you to stop smoking if you do smoke, because it also affects your chances. And then the woman to maybe ask to reduce weight, because if the woman is obese, it also affects the chances of conception. There are also specific treatments. So the earlier ones that I mentioned are the general treatments, and then the specific treatments are the targeted ones. So once the cause is ascertained, if it is the uterus, then they will find out to come up with an appropriate solution to that. If it is the tubes too, an appropriate solution is actually meted out to the woman. So those with blocked tubes, they can do an IVF, which we call in vitro fertilization. It's very expensive, but it is worth it if it actually succeeds. And there are some people who have problems with the release of the egg, those with PCOS, that's polycystic ovarian syndrome. And then when they have high levels of milk producing hormones, that one it will give you medications to treat them. I don't want to mention the medications, because when it comes to the treatments for infertility, you have to go to the hospital to get the needed actual treatment, so that you do not do self-medication. For the male factors, once the sperm analysis is done and they are able to come up with the specific cause, whether it is the count, if the count is low, they will give you medications that will boost the sperm count. If it's the shape and all that, I mean, the medical people have a way of treating it so that it will increase the chances of treatment. There are other treatments known as using the assisted reproductive technology, that's the ARTs, that's the IVFs for the women and all that. So the solution, don't call in your room, don't just say that when God gives me, that is fine. There's so much knowledge out there, there's so much treatment option available. If you seek help from the fertility centers and fertility specialists, they will be able to help you increase your chances of conception. Thank you so much for making time to watch this episode. We'll be doing our last episode on infertility in the coming episode, so don't forget to anticipate in a week from now. You will enjoy watching it, trust me. Thank you very much. Subscribe, like, share, and press the notification button so you can receive our videos, and share your comments on what you have watched so far. Thank you very much. Bye-bye.